Fact check. Trump disputes HHS IG report, repeats several other false claims at Monday's coronavirus briefing. During his coronavirus briefing Monday, President Donald Trump clashed with reporters and made a number of false and misleading claims. Here's our fact check below, which will be updated as we check his claims. Fact-checking Trump's claims on the HHS IG report at Monday's briefing. Fox News correspondent Kristen Fisher asked the president about a recently released report from the Department of Health and Human Services Office of Inspector General, which details challenges facing hospitals in responding to the coronavirus pandemic, including shortages of supplies and equipment, as well as prolonged wait times to get testing results. In response, Trump said, "It's just wrong. Did I hear the word Inspector General really? It's wrong." When pushed on the fact that the report was released by his own administration, Trump suggested the findings were politically motivated, asking, "Well, where did he come from, the Inspector General? What's his name?" Trump later added, "So give me the name of the Inspector General. Could politics be entered into that?" Facts first. There's no evidence to suggest anything about the report is wrong or that it was somehow politically motivated. The report was independently launched by the HHS OIG and based on interviews conducted between March 23 and 27 with administrators at more than 300 hospitals across 46 states, Puerto Rico and Washington, D.C. The report found hospitals face testing shortages and longer than usual wait times for coronavirus test results. The report's findings of shortages at key hospitals also corroborated previous press reports from hospitals in New York and elsewhere, which are facing severe shortages of vital medical equipment. According to the HHS report, its purpose is to provide a snapshot of hospitals' experiences amid a growing number of coronavirus cases and doesn't serve as a review of the department's response to the outbreak. The senior HHS OIG officials who oversaw this watchdog report are both women. Ann Maxwell, the Assistant Inspector General for Evaluation and Inspections, and Christy Grimm, the Principal Deputy Inspector General. Grimm, whose name is on the report, is a career official who entered her current role in January but has been with HHS since 1999, serving under both Republican and Democratic administrations. Coronavirus tests on Monday, Trump claimed, as he did last week, that his administration had initially been burdened by an obsolete test for the coronavirus. Initially speaking, the tests were old, obsolete, and not really prepared, he said Monday. Facts first. The faulty initial test for the coronavirus was created during Trump's administration in early 2020 by the Centers for Disease Control and Prevention. Since this is a new virus that was first identified this year, the tests couldn't possibly be old or obsolete. He is lying. He is lying 100%. He is lying because he is trying to shift blame to others, even if the attempt is totally nonsensical, Greg Gonsalves, an assistant professor in the Department of Epidemiology of Microbial Diseases at the Yale School of Public Health, said of a previous version of Trump's claim. "The claim doesn't make sense because it is false," Tara Smith, an epidemiology professor at Kent State University, said of a previous version of the claim. "This is a new virus." Sticking to past practice, the CDC created its own test for the coronavirus rather than use the test being distributed by the World Health Organization. The CDC began developing its test in January 2020 and announced on February 5 that it would begin shipping test kits to public health labs around the U.S. Soon after that, there were reports that some of the test kits were not working properly. The CDC admitted the problem on February 12. It announced February 28 that it had manufactured brand new functional test kits that addressed the problem, which had been caused by a flaw in one of the three components of the original test. Trump on performance of the small business lending program during Monday's White House Coronavirus Task Force briefing. Trump claimed that the Paycheck Protection Program, a small businesses lending program, has really been performing well. Trump said there were a few minor glitches that have already been taken care of. Facts first. CNN has reported significant issues to the Paycheck Protection Program, PPP, with system-wide failures as lenders process these loans. Days after the launch of the Small Business Administration's rollout of the PPP, there are still delays in the system lenders use to upload loan application information, and the money is still largely not going out to the businesses that need it yet. According to an industry source who spoke to CNN, major system-wide failures continue to crop up in the PPP system, including shutdowns preventing the submission of applications from lenders on their system, known as E-Tran. These issues have slowed down the ability for banks to participate in the loan program, this source tells CNN. Additionally, several bank executives tell CNN they want the Treasury Department or the Small Business Administration to offer more guidance on how they are supposed to disburse funds. CNN reporting indicates there are also concerns among lenders who say they won't cut checks until there is clear guidance on how they should distribute the money. To read more about the early glitches in the small business lending program, read here and here. Trump falsely claims plane passengers are being tested for the coronavirus. Asked about the possibility of restrictions on travel between coronavirus hotspots, Trump said, "There's also testing done when people get onto those planes and also when people get off the planes. Facts first. There is no evidence that plane passengers in the U.S. are being tested for the coronavirus at all, let alone both when they get on and get off the plane. While it is theoretically possible this is happening under the radar at a particular airport, it is certainly not happening widely." Trump might have meant to refer to screening, which involves questioning and sometimes temperature checks, rather than actual testing, but major U.S. airlines are not doing screening either. Some plane passengers are being subjected to government screening upon landing, but most passengers are not, and the screening, unlike testing, cannot conclusively determine whether someone has the virus. To read a full fact check, read here. Click subscribe to receive the latest news.